Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Are you thinking about starting your own podcast? If so, Anchor is the easiest way to make a podcast. Let me explain. Number one, Anchor is free. Anchor has all the creation tools that allow you to record your podcast and edit it right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, Google Podcasts, and many more. You can make money from your podcast with no minimum listenership. Anchor is everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. Hello, my faithful listeners. Welcome to episode 29 of the Health Flow Podcast. And I just want to thank all of you who are just hanging in there with me and continue to listen. So, like I said, episode 29, and I thought about what would be appropriate this week to have a discussion. And something came up, the coronavirus. So let's talk about this virus. So the coronavirus is a human and animal pathogen, and it can cause up to about a third of community acquired upper respiratory infections in adults and children. And it can also cause diarrhea in infants and in adults. So this virus was actually identified as the cause of pneumonia in a city called Wuhan, that's in China, the city in Hubei province of China, to be exact. Now, right there, they're having thousands of cases have been confirmed in China, and the count is daily rising. Um, the majority of the cases are, like I said, in China, but globally, we're seeing more cases. It's really at this point unclear as to whether the coronavirus is directly transmitted from bats or there's other thoughts of other mechanisms. So right now, we're really not sure. Um, Clinical features of the coronavirus is just like really the influenza virus. Um, Fever, cough, we say dyspnea, which could be like short of breath or difficulty breathing. On an x-ray, you can have bilateral infiltrates. The incubation period is within 14 days after exposure. So the incubation period is the time from when you're exposed to the time that you actually develop symptoms. So far, what's being seen is that 20% of the confirmed cases of coronavirus have 20% of them have really become critically ill. And in most of the cases that have been fatal, they've really been fatal because those individuals have medical comorbidities. Just like with our annual flu, if you some medical comorbidities could be if a person has, say, you're diabetic or you have COPD, or you're an asthmatic, or you have cancer, or you have any illnesses that causes your immune system to be lower than what would normally be, then you're obviously at higher risk. Any one who's suspected to be infected should wear a medical mask. And listen to me, I'm saying a medical mask. I see people, they're traveling and they just randomly have a mask that matches their outfits. Why that doesn't work is that the respiratory particles are so small that they can still actually go through um, a mask that's just made from regular material. And that's why we say medical mask. In medicine, we actually have different type of masks. For example, there's regular surgical masks. Then there's the N95 mask. Anyone that's in medicine know that the N95 mask is one of the ones that we wear when we're trying to prevent um, the spread of TB. So one of the things that we do in the hospital, that hospital workers that are taking care of patients directly, is that you get fitted for an N95 mask with an N95. Years ago, and I think we're still doing that, they used to actually spray saccharin, which is sugar, like a sugar spray, while you have the mask on right in front of you to make sure that it fit you properly, that you could not taste the sugar when saccharin was sprayed. That's how good that mask is. Very expensive, not recommended generally, only when we know for sure someone has TB and we have to enter the room that we would use that mask. So far, the test that could be done is really the nasal pharyngeal or the oral pharyngeal swabs. If possible, the CDC also recommends respiratory sputum collection, and they also recommend serum blood collection. Now, let me say this: serum blood collection, this test is only done at the CDC. So please don't show up to your emergency room asking to be tested for the coronavirus, because the hospitals don't have the test for it. So please just just consider this. I mean, there's over 100 strains of the flu, and each year we're only able to test um, for influenza A and B. So you're not going to get that done, not at your regular hospital. Now, if you are suspected, and maybe if now that they're collecting information, and if you're officially diagnosed and fit all the sequence, remember, if you did not travel from China or have not been around someone who traveled from China, the likelihood of you being exposed to this is really very unlikely. What the CDC is recommending now is that for the United States, um, only essential travels to China, and those who are returning from China should be under quarantine for 14 days. So if you don't have to go to China, you should not be going. And those who are coming back from China should be under quarantine for 14 days. And we say under quarantine for 14 days because the incubation period is 14 days. 14 days from the time you were exposed to actually developing symptoms. Now, treatment of anyone suspected to have the coronavirus is number one would be infection control. We're even recommending if someone has a mild case that they should stay home, because if you stay home, you're not going to go out in the public, and then you should be quarantined in your own home and not going out to the public or to the hospital, the stores, public places where you can transmit the illness to someone else. You would be given supportive care. And really, if your doctors or medical providers need guidance, they would be contacting the CDC or the World Health Organization. So, supportive care really is keeping a person hydrated, making sure that we treat your temperature. That's the most important thing. And there's no treatment right now. There's no available antivirals at this point. Antivirals that are purely investigational. Um, so, infection control, supportive care, and guidance from the CDC or the World Health Organization. Now, how can you prevent this? First of all, don't go to China right now. If you have already been to China or been around someone that's in China, we suggest that you quarantine yourself for 14 days. Um, but really, all jokes aside, all the same basic things: diligent hand washing, respiratory hygiene. What does that mean? If you're going to cough or sneeze, you do it, by covering your mouth. You bring your elbow, put your mouth and your nose cover in the fold of your elbow. Avoiding close contact with live or dead animals or individuals who are sick, and wearing a medical mask. A medical mask. I've been seeing people with masks all around, and I'm just like chuckling inside because I'm thinking, oh, you're not preventing yourself. You're actually doing better by just avoiding close contact and good hand washing than wearing masks that are made from materials. Um, the basic thing, it goes back to the same way we treat the flu. Um, at least we know with influenza A or B, you can have the flu shot. And I know there's people that swear out there they've taken the flu shot and then they've gotten sick. Couple explanation: you cannot get sick from the flu shot because it's a dead virus. That's number one. Number two, because I think with the flu, there's like 1 to 4 days of that you can from exposure to actual symptoms. So, and another thing to consider is when you get the flu shot, you need 7 to 10 days of it before it becomes effective. So if you got exposed, say just a scenario, I got exposed to influenza um, 2 days ago. I'm not sick. I didn't know I didn't get exposed. But on the third day was the day that I went to get my flu shot. I got my flu shot and I'm fine. And day 4 or day 5, I'm now sick with flu symptoms. I know that we just want to think that it's the flu shot that did it, but it really is not. There's not a way to medically explain that. It doesn't make sense. It's a dead virus so that you're given. So your body's not going to say, hey, you've given this. Now I'm going to be sick. Like I'm injecting you with a live virus. No, it's not. Um, that's not the way it works. And you just, you're in your time of exposure and now you've developed symptoms and you didn't have the flu shot long enough before, for you had to have developed an immunity against it. So that's why really generally places start giving the flu shot early. I usually take my flu shot just like by the end of August when kids are going back to school. um, definitely early September, I get my flu shot. And because I want time for it to be effective before I, come up, get in contact with someone. Now, this year I got sick, but there's over 100 strains. When I did not test positive for A or B, so it's just another strain. But A or B is the worst strains. They're usually the most lethal, the most potent ones. So I mean, I'm not here to convince you. I do think it works. I do believe in the flu shot. If you'd rather just get the illness, that's fine. I'm okay with that too. Um, but just make sure that we're doing all the basic prevention, not really get too crazy with the coronavirus at this point. Um, from what I heard this morning and what I read, there are 11 reported cases in the United States. I think the last two that I heard this morning was from a family that traveled. They returned, maybe, I don't remember if it was a husband or wife. One family member returned from China, and then another family member got it. So just be mindful. If limit your travel to China, and for those who are returning from China, they should be quarantined for 14 days. All right, I hope you found this podcast informative. Have a wonderful day. Until next time. Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.